We designed appropriate empiric therapy for HAP and VAP, and we de-escalated from empiric therapy to pathogen-directed therapy. We also evaluated patients' clinical stability to switch from IV to PO and recommended appropriate duration of therapy for HAP and VAP. Now let's develop a patient-specific plan for prevention of pneumonia. When it comes to the prevention of pneumonia, the older 2007 IDSA guidelines has several recommendations. Of course, influenza can lead to secondary bacterial pneumonia, so influenza vaccine is recommended, as well as pneumococcal vaccine, which I will discuss shortly. Now, for patients who are hospitalized, vaccination can actually be performed at discharge prior to patients going home, and of course, it can also happen in the outpatient setting. Smoking is a risk factor for pneumonia, so smoking cessation is very important in preventing community-acquired pneumonia. And those who continue to smoke, influenza and pneumococcal vaccination is really important for them. And of course, respiratory hygiene, including washing hands, is really important in preventing spread of germs. The new 2019 IDSA guidelines did not make any new recommendations for prevention of pneumonia. Before we talk about pneumococcal vaccine, it's important to distinguish between pneumococcal disease and meningococcal disease. When we say meningococcal disease, we are talking about meningococcal meningitis specifically, and this is caused by the organism Neisseria meningitidis, which is a gram-negative coccus. Now, there are 12 serogroups, so you will see this in the meningococcal vaccine, and there are different vaccines. For example, the MenACWY has 4 serogroups here, whereas MenB only has the B. Now, when we talk about pneumococcal disease, there are 2 diseases that this may be referring to. So pneumococcal meningitis and also pneumococcal pneumonia. And this is basically caused by Streptococcus pneumoniae, which is a gram-positive coccus. And there are 91 different serotypes. Now we have 2 different pneumococcal vaccines. We have the Pneumovax 23 and we have Prevnar 13, which I will explain shortly. Now it's important to distinguish between these two because there is some misconception out there. When we talk about meningococcal disease, people may refer to this as meningitis vaccine. So it is true that by taking meningococcal vaccine, you will basically prevent meningitis due to Neisseria meningitidis. And people may refer to pneumococcal vaccine as pneumonia vaccine. This is where the misconception comes in because Streptococcus pneumonia can cause pneumonia, but it can also cause meningitis. So by giving patients pneumococcal vaccine, not only are we trying to prevent pneumonia, but also we are trying to prevent meningitis. In fact, Streptococcus pneumoniae can cause several systemic infections, including non-bacteremic, such as pneumonia, and it can also cause bacteremia, which can also lead to meningitis. So meningitis, you can see a smaller portion of these cases are meningitis, but the fatality rate is much higher in meningitis compared to other diseases caused by Streptococcus pneumonia. So really, in order to prevent meningitis, you need 2 vaccines. You need meningococcal vaccine and you need pneumococcal vaccine. There are currently 4 different pneumococcal vaccine products on the market in the United States. The first one is Pneumovax 23, which is a 23-valent pneumococcal polysaccharide vaccine. And what that means is that it includes 23 serotypes of Streptococcus pneumoniae in this vaccine. It is approved for ages 2 years and older, and it is available as a 1-dose vial. So this needs to be drawn into a syringe, can be administered as an intramuscular or a subcutaneous injection, and all of these products must be stored in a refrigerator. And then, so this is PPSV, the rest of them are PCV or polysaccharide conjugate vaccine. And the first one is Prevnar 13, so this is a 13-valent and it has 13 of those serotypes. This is approved for ages 6 weeks of age and older. And all of these PCVs are available as a pre-filled syringe, so they can only be given as an intramuscular injection. Most recently, we had Vaxneuvance and Prevnar 20 approved. So Vaxneuvance is a 15-valent PCV, And Prevnar 20, as the name suggests, is a 20-valent PCV. Of note, when both of these came to the market, they were initially approved for ages 18 years or older. Most recently, Vaxneuvance got approval for ages 6 weeks and older. And I anticipate in the next few months, Prevnar 20 will also get approval from the FDA for 6 weeks of age and older. But currently, it's only available for adults 18 years or older. Let's take a look at differences between the two main different types of pneumococcal vaccines, pneumococcal polysaccharide vaccine and pneumococcal conjugate vaccine. There are different modalities of vaccines. So polysaccharide vaccines are processed as non-T lymphocyte dependent immunogens, but not immunogenic in children younger than 2 years of age. So that makes it a problem. So that's why pneumococcal polysaccharide vaccine is only available for ages 2 years and older. It's just ineffective for anyone under the age of 2. Protein vaccines, on the other hand, are processed by T lymphocytes and even in neonates induce antibodies. Because these vaccines essentially use the polysaccharides on the capsule of pneumococcal or Streptococcus pneumoniae, one strategy is to link these polysaccharides to a protein carrier, which can be processed by T lymphocytes, and this results in a more long-lasting protective antibody response, even in the very young age, under the age of 2. So that's essentially what we have done with pneumococcal conjugate vaccine. So, and because in general proteins are larger than polysaccharides, there are fewer of these serotypes that were able to fit into the vaccine. So, the polysaccharide, because these are all pure polysaccharides, there are 23 different serotypes in here. With PCV13, proteins, each one of these serotypes is linked to a protein. So only 13 of them could fit. But this is a much better vaccine because of higher immunogenicity in general, but also in young age, under the age of 2. So from 6 weeks to age 2, this would be very effective. So let's compare the efficacy. So for the pneumococcal polysaccharide vaccine is essentially effective in preventing invasive pneumococcal infection. So when we say invasive, think of meningitis. So essentially infection in the brain. And unfortunately, it does not seem to be effective in preventing pneumonia. So none of the studies that evaluated polysaccharide has not shown efficacy for preventing pneumonia. Whereas PCV, it is very effective in reducing invasive infections like meningitis, but also it has been shown to be effective in preventing non-invasive infections such as pneumonia. So historically, people had to get both of these vaccines, PCV13 first because it's very effective, and then Pneumovax 23 to supplement all those serotypes that are not included in PCV13. However, as technology has advanced, we have been able to include more serotypes in the vaccine. So with the PCV15, which came to the market in, actually both of them came to the market in 2021, we have been able to include more serotypes in the PCV vaccines. So PCV15 has 15 serotypes, and what they have shown is that they have shown non-inferiority when it comes to immunogenicity to PCV13. So all of these 13 serotypes in PCV13 are included in PCV15, and it has 2 additional serotypes. So of course it has been shown to be superior to PCV13 for those 2 unique serotypes, but also it interestingly had better response for serotype 3, which is also included in PCV13. So PCV15 immunogenically pretty good vaccine. Now these are new, so we don't have clinical data. So is it more effective as far as preventing non-invasive and invasive pneumococcal vaccine? We just don't know yet. Now the same can be said about PCV20. So it has all the 13 serotypes from PCV13, and it has 7 new serotypes in it, and it has been shown to be non-inferior to PCV13 with the 13 that are shared. And also PCV20 is targeting more of those serotypes in PPSV23 in the hopes of eliminating the need for getting PPSV23. And it has been shown to be non-inferior to those 7 serotypes that are also included in PPSV23. So here are the recommendations for receiving the pneumococcal vaccination. So in general, we can think of healthy persons with no risk factors for getting pneumococcal disease, and then of course those who have risk factors, and we'll go over what those risk factors are. So in general, for healthy individual, no risk factor, and this is in individuals who have not received pneumococcal vaccines before, because pneumococcal vaccine is also part of childhood immunization nowadays, but a lot of adults, these childhood immunization was not available at the time they were children. So for the large part, the population has not received childhood immunization for pneumococcal. But as time goes on, more and more children who receive their childhood immunization go on to be adults. So these recommendations change in time. So for those who are pneumococcal vaccine naive and are healthy with no risk factors, essentially prior to age 65, it's not recommended for them to receive pneumococcal vaccine because they are not at risk of being exposed to Streptococcus pneumoniae and develop severe disease. However, once individuals turn 65, they are at risk of developing pneumonia and meningitis and other infections due to Streptococcus pneumoniae. So it is recommended for people age 65 to receive 1 dose of PCV20, or if they want, they can get 1 dose of PCV15 instead. So it doesn't matter which one they get. So both of these are now recommended for these individuals. Now, however, because there is a gap between PCV15 and 20, it is recommended that if somebody chooses to get PCV15, they should also get a dose of PPSV23 at least 1 year later. So it's important to note that PCV and PPSV vaccines cannot and should not be administered at the same time. There should be a large time gap between them, and that is recommended to be at least 1 year. So here's what the timing looks like. So obviously, if somebody gets PCV20, they're done. There is no need for them to get PPSV23 because most of PPSV23 is covered here, and PCV in general is a better vaccine than PPSV. However, if somebody gets PCV15, they will just have to wait 1 year and then get 1 dose of PPSV23, and they are done. Now, what if somebody had already received the PPSV23 and they have not received their PCV yet? So for those individuals, again, it's recommended that as long as it's been at least 1 year after their PPSV23, then they can get either PCV15 or PCV20. It doesn't matter which one they get. They can get PCV20 if they want, and then they're done. So after this, there is no need for another PPSV23. Now, vaccine doses do not need to be repeated if they are given prior to age 65. So for whatever reason, if somebody received these vaccines prior to age 65, there's no need for them to be repeated after 65. And when PCV15 is used in those with history of PPSV23, it need not be followed by another PPSV23. And lastly, for adults who have received PCV13, which is still on the market, but not completed their recommended pneumococcal vaccine series with PPSV23, they do have the choice to get the PCV20 if PPSV23 is not available. Now, let's take a look at those with risk factors. So the risk factors, I have broken them into 3 categories. So the first category is they are immunocompetent. These are just comorbidities. And then the second group are still immunocompetent, but they have some conditions that could expose them to Streptococcus pneumoniae entering the brain and develop meningitis. So this is relatively higher risk than the first group. And then the last is immunocompromising conditions. So things like asplenia, cancer, HIV, transplant, and other things on the list. So for any of these groups, the recommendation is the same. So essentially, this is, because these are high risk, we're not going to wait till they are 65. So as between the age of 19 to 64, and this is assuming that, they have not received childhood PCV vaccination, assuming childhood immunization was either not available for these individuals or it was available and they chose not to get them. So between the age of 19 to 64, it is recommended for these individuals who have any of these risk factors to receive 1 dose of PCV 20, or they can choose to get 1 dose of PCV 15. So it doesn't matter which PCV vaccine they get. These are very effective. It's important to prevent invasive and non-invasive pneumococcal infection in these individuals. Now, if they do choose to get PCV 15, it is recommended for them to get 1 dose of PPSV 23, and it is important to get it at least 1 year apart. Now, this 1 year apart becomes essentially 8 weeks for those higher risk. So if they have just comorbidity in the first group, they have to wait at least 1 year. But in the second group and the third group, because they are so high risk that you may consider to not wait for a year to give the PPSV 23, you can shorten it to 8 weeks and give them PPSV 23 if they got PCV 15 in order to give them full coverage given their high risk conditions. Now, as before, if for whatever reason they had happened to get the PPSV 23 first, then you just have to wait 1 year to give them either PCV 15 or PCV 20, whatever they choose. Once you give this vaccination, they're done. So once they turn 65, if they have received this, there's really no need for them to get another vaccine. Now, if they turn 65 and they had not received this vaccine, so it is recommended 1 dose of PCV, either 15 or 20, just like before, or if they had previously received PCV 13, they still need to get a PPSV 23, or they can even get PCV 20 once they turn 65. And here's a summary of what I covered in a table format, which I let you pause this video and review.